Well, good evening, everybody. This is Dr. Jack Bielitz. I can't believe how many of you are on this call tonight. It is beautiful outside, so obviously this is an important topic for you. I know it's a very important topic for me. That's why I'm here. So let's get into this and give you some great information. Depression is such a dangerous thing, and we've got some great information for you. So let's get started here. For those of you that don't know me, I've been doing this for over 10 years with all of the knowledge, trials, tribulations, success, patient visits, new patients, the results. I've been getting people off of bad stuff like Prozac, Zoloft, Lexapro, Effexor, Cymbalta. These are things that people were forced to use because they were dealing with depression and didn't know any other options, because that's the mainstream thing to do. And so when you start getting some of the side effects, you start looking around and wow, there's some amazing things out there. So we're going to talk a little bit about this. But the first thing we want to talk about is the fact that you're not alone. Over 16 million Americans are diagnosed with depression. 1 in 4 women over the age of 35 are taking an antidepressant in the United States. And it's estimated that 50% of Americans have major depression. 1 in 8 adolescents suffer from depression. So that to me is probably one of the scariest ones, because that number is starting to really rise. And we'll talk a little bit about why that's happening a little bit later. 7 out of 10 people who are taking antidepressants are feeling less joy or pleasure in things that they used to enjoy. I don't know about you, that's not the way I want my kid to live life or myself. So let's talk about some of the limitations of antidepressants. First of all, they're the most frequently prescribed antidepressants, do not manage depression successfully for everyone. Now, studies show that only about 30% of the people with depression experience complete relief from their symptoms when using these medications. So when you look at some of the side effects of these, you wonder why, with only a 30% success rate, that people would try to do this. Now, one of the big problems is no one knows exactly how antidepressants work. Even the companies that make these drugs don't really know how they work. So even though Prozac, for instance, was released over 30 years ago, not a single study has been performed, or at least reported, on its long-term effects that was longer than 13 weeks. That should cause you to stop, because when something's been around for 30 years with the millions and millions of prescriptions that are written for this stuff, there's plenty of money to be doing research on this. It's got to be being done. So where are the results? Are they that scary that they don't want to release them? They must be, because I guarantee you, if they were good, you would know exactly what they were. Now, about 50% of kids that are placed on antidepressants for more than 5 years are going to be converted to a bipolar diagnosis, and then all the medications associated with that. And that's the same thing that's going to happen to you if you're an adult. About 25% of the adults are going to convert to bipolar diagnosis. So obviously, there's some pretty crazy stuff going on in the way your brain chemistry is functioning. Now, these drugs will double your risk of bone fracture. They'll double your risk of suicide. They'll triple your risk of diabetes, and 32% increase in heart disease. Now, you might be stopping and saying, wait, diabetes and heart disease are affected by these? What's going on here? Well, yes, they are. That's how powerful these drugs are. They will literally affect not only your heart, but also your GI system and tract. Now, they're also linked to the violent behavior, movement, and suicide, and many more things. So let's talk a little bit about these individually here. The first one's the SSRIs. So that's the Prozac, the Zoloft, the Lexapro. Side effects include suicidal thoughts and behaviors, emotional numbness, and serotonin syndrome, which is agitation, hallucinations, rapid heart rate, high blood pressure, muscle rigidity, and high fever kind of all rolled in to one symptom. They're also responsible for sexual dysfunction and an increase in anxiety or agitation. Now, a few years after the SSRIs, the SNRIs became around, and that's the Effexor, the Cymbalta, the Brastic, suicidal thoughts and tendencies, the emotional numbness, and the serotonin syndrome. Those are all the same, but this one brings in high blood pressure and, scarier yet, withdrawal syndromes. So if you get on these, you're going to have a real tough time getting off. So there's a lot of people that get on these and they're going to be on the rest of their life because the side effects can be devastating. So while antidepressants are often seen as the standard, I would hope that listening to those, the significant risks that they bring would cause you to seek out a more effective and safer alternative to these medications. So in order to solve depression, you have to look at what causes depression. So if you're feeling depression, the symptoms of depression, it's basically chemicals reactions that are taking place in your brain. Now, it may make sense that we should just adjust these chemicals in your brain, and that's exactly what antidepressant meds try to do. However, those medications were designed based on a 4-chemical model that was created in the 1970s. Now, we know now that there's at least 115 neurotransmitters that control your feelings. No wonder there's problems with these things. You know, the crazy thing is, with these 115 chemicals, every single person is going to react differently to these different chemicals. So there's no way that a single drug is going to be effective for everyone, or even 5 drugs, because there's just too many variables here. So a better way to try to combat the depression might be, let's try to understand what causes the change in the chemicals that give you the symptoms of depression, and instead of trying to fix that, maybe stop that change from happening in the first place. Because if you do that, we don't need the drugs. We don't feel depression. So just stop the problem to begin with. So in order to do that, you have to get by to what causes those feelings of depression. And first thing you need to understand in that aspect is that when you encounter major stress, your body goes into a state that we call sympathetic overdrive. So what does that mean? Well, in your brain, there are 2 states of mind that you can be in at any given time. The parasympathetic brain is kind of the where we should live most of our life. It's the part of the brain that you need to be in order to, like, read a book or fall asleep or think higher thoughts, like access your higher thought process. For instance, connect to God, have an intelligent conversation with a friend, go to school, things like that. It allows you to see the big picture in life. Now, if you only had that aspect of life, of brain, well, for instance, back in the caveman days when, like, there was wild animals around, if a tiger walked into your encampment, you'd die. Because by the time you could react with that parasympathetic brain, you'd be dead. So the humans that survived were the ones that had a switch that they could flick in their brain and go into what we call sympathetic or overdrive brain. Now, this is the brain that's designed for survival when a life-threatening situation happens. You get to a certain threshold and all of a sudden you get into this brain set. It's important. We don't want to get rid of that. I mean, that's an important thing to have. So what happens, though, is that the blood in your body goes, all of it as much as possible, goes into your extremities. That gives you all the energy possible to be able to fight off the danger or to run as fast and as far as you possibly can. But it's not just physical things that happen. your brain changes too. So instead of stepping back and seeing the big picture in life, your brain goes into what we call a hyper-awareness mode. You're quickly looking at your environment, accessing everything. Where can I escape to? What can I use as a weapon? Everything is just analyzed very quickly. Again, very important if you're going to survive. But as far as depression goes, what are some of the major symptoms of depression? Well, excessive worry, trouble concentrating. These are important ones that, people deal with when they're dealing with depression. And if you think about it, both of those things are things that should be done with the parasympathetic brain. Your sympathetic system is for being alert. It is for worrying. You're not supposed to be able to concentrate on one thing. You're supposed to be able to taking in everything all at once as much as possible, so that if you have a danger in one area, you're still looking at the other areas, so in case another danger comes along. So you should not be in sympathetic overdrive mode if you are dealing with a threat to your life. And all of this is due to a flood of hormones that are going through your body and not only changing where your blood is going, but changes the way your blood or the way your brain thinks. So if you could stop your brain from going into sympathetic or overdrive mode, you wouldn't have to experience the depression symptoms. So this eliminates the need for the dangerous drugs that have all of the bad symptoms and are way too common in our society. So what causes our brain to go into sympathetic overdrive? Well, we said a life-threatening event is what would cause it. So back in the caveman days, it would be like a tiger walking into your encampment. If you see that, you're going to freak out. And it would cause you to go into that. But what you want to understand is, we don't have those life-threatening situations for the most part in 21st century United States. But we can have enough stresses that add up. So where do we get our stresses from? Well, we have 3 types of stresses: physical, chemical, and mental emotional. A physical stress would be like a car accident, falling off your bike, falling out of a tree when you were a kid, tripping on the sidewalk. All of these are physical stresses that you encounter, and let's face it, they're kind of common. The next one is chemical stress. And, when my parents were kids, the chemical stresses were kind of limited to like working in factories and stuff like that, because, you pretty much ate at home and you had pretty good food when you did that. Even when I was a kid, going to McDonald's was a big treat. You only did it every once in a while. It wasn't like a staple. But so many people look upon fast food as a normal daily thing for either lunch or dinner because of the fast-paced lifestyle that we have for us and our kids. Then you've got, think about the pesticides and herbicides that are in your lawns or keeping the bugs out of your house. Think about what the same type of stuff at the building that you live in, you work in, or the school that your kids go to school in. Chemical stresses are everywhere in our society. And the last one, mental emotional stress. Oh my gosh. It used to be, before we had these little things that we call smartphones, you didn't really have as much stress because you didn't really know anything more than either what was on the news or what was happening in your immediate life. But now, my gosh, you can pick up that little device and find out what's happening to your second cousin's hairdresser because of social media. You can find out how bad one of your friends from grade school was, even though you haven't seen him in 30 years. All of these things create stress that you have to deal with. And if all of these physical, chemical, and mental, emotional, even though they're not any one of them a big deal, these little stresses can add up and push you over that threshold and get you into sympathetic overdrive, which is going to change your brain chemistry and then cause the symptoms that we're talking about that cause you to feel depression. So if you want to avoid that, what can possibly be done? Well, our office has really advanced techniques that can basically extinguish a lot of the emotional charges, especially on past events that are just sitting in there ready to trigger responses to normal stresses in your daily life. This is why so many kids are having problems now. You may not think that your kid has a pretty rough life, and they probably don't. But they are so aware of the stress that they have that it's starting to trigger responses from past experiences. And these are the problems that are pushing more and more and more kids into this depression state of mind. And it's all because of these multiple smaller stresses adding up, pushing you over that threshold and getting you into sympathetic or overdrive brain. So you're probably going to want to know. It's like, okay, do I have that problem? Is that something that is causing my depression? Well, the great thing is we have a way to figure that out. We have 3 computerized tests that we run at the office that give us a readout of how your body has responded to the stresses that you've had in your life. For some people, they've had a pretty crap life, but yet they've managed to not be affected by any of it. Then there are other people that have a really pretty dang good life, but because of the way they took things when they happened, they are more susceptible to these problems. And that's not a good thing. It's not a bad thing. It just is a fact. And those are the people that are going to be suffering from these things and then potentially wanting to get on these medications that are so dangerous. So I'll bet you're thinking right now, do I have these problems? Well, listen, we are 17 minutes into this little talk here. And if you have stayed with us that long, and I can't believe how many people are still on this, I thank you very much for being here. But if you are still on this, I want to offer you an amazing value, because normally our consult and the 3 tests cost $250. And that, quite frankly, is a great bargain because it gives you so much information that you can take with you and just know about yourself. But since you are here on this call, we are going to offer you that for only $37. Now, obviously, I can't afford to do that for every single person that wants to come in. So what I've done is I've set aside 10 appointments for this special promotion. So if you want to take advantage, call the office right now, 402-809-7979. If you give that number a call and nobody answers, just leave your name and let people know that you want to take advantage of us. Give us your phone number and we'll give you a call back tomorrow morning and get you scheduled for this, because we're going to take everybody in the order in which the calls were received. However, if you want to skip the call line, you can go online right now and just scroll down on our depression page and you'll find a place where you can set your own appointment up. We've got spots locked in there. So if you want to just figure out what time and day works best for you, just click on it, fill out the information, and we will get you scheduled for that. All right. I hope this was great information for you. I hope you learned a lot. I don't see any questions in the chat right now, so that either means that people fell asleep or that I was able to explain this stuff in pretty easy to understand form, which is what I try to do. So if you do have questions, give us a call. I will schedule some time with you on the phone if we need to, but I want to get your questions answered, because the more people that we can keep off of those dangerous drugs, the happier my life is going to be. Hope you guys have a very pleasant evening. Stay healthy, Omaha.